Okay, so hello everyone. Thank you for joining. My name is Itzik Fegelevich and I'm a senior product manager at Checkpoint. And together with me today, I'm very excited to have Tom Finn. He's the director for business development for Medigate. Medigate is one of our leading partners for healthcare cybersecurity solutions. And I'm very honored to have with us Robert Koski. I hope that I pronounced it correctly. He's the CISO for Heritage Valley Health Systems, one of the leading hospitals in Pittsburgh area. Tom, Robert, thank you for joining. Maybe you should introduce yourself and say a few words about Medigate and Heritage Valley.
Sure. We have a long relationship with both Checkpoint and Medigate, and that's why this is such an exciting presentation to make, because I think we have a good experience to share with everybody. Working with such dynamic organizations that work well together really has given us a great opportunity to reinvent how we approach cybersecurity management and risk management within our organization.
Wow, amazing.
Yeah, and on the Medigate side, we are a healthcare security and operational analytics company. On the security side, we protect our health system clients like Heritage Valley from the risks posed by the devices that connect to their networks. And on the operations side, we gather an awful lot of data, create live connections, and orchestrate that data throughout the ecosystem, improving a lot of workflows and, in fact, through delivered automation, eliminating a lot of outdated manual routines. So, again, for us, we're excited to be here. We're a long-term partner and a next-door neighbor in Tel Aviv, as a matter of fact, with Checkpoint. And Heritage Valley Health System and Bob they were early adopters in this marketplace. So we've known each other for quite some time and watched the solution market develop together.
Okay, amazing. Okay, so thank you for joining me. Let's start the presentation. Press here. Okay, so just in case there are people here in the audience who are not familiar with Checkpoint, we are the leading cybersecurity company in the market today. And we have tens of thousands of customers that we are already working with. And out of them, many are healthcare providers, hospitals, and other healthcare providers, customers that we are working with. And our mission is to allow any type of organization to be able to conduct their business over the internet with the highest level of security. In order to do that, we offer in a quite wide range of product portfolio that enables protections against any types of threat in the market today. We have solutions for the network, for the perimeter, for the data center, for the cloud, for users and access, and for mobile and endpoint, and of course, also for IoT and medical devices. Now, definitely, healthcare is one of the more important verticals that we are focusing on today. We've clearly noticed that in the last years, the healthcare providers are very attractive for cyber criminals. And this is probably because of two reasons. First, it is, let's be honest, quite easy to hack into a healthcare network. And second, once you're inside, you have a great opportunity to gain significant profit. And you can do that by stealing medical records or through ransomware attacks. In a report that we've published, Checkpoint published a few months ago, we found out that the healthcare is the most targeted vertical for ransomware attacks in the market today. Now, the attackers, they are very sophisticated and they keep improving their methods all the time. And we found out, for an example, that the attackers know how to adapt their attacks so that the amount of the ransom will be covered by the insurance company of the hospital. We've also found out that they know how to make sure that the amount of the ransom will be lower than the financial loss that it is causing to the hospital. For an example, you don't need to go and lock down the entire hospital network. You can maybe lock down just one machine, maybe let's say the MRI machine, and let's say with a ransom of $1,000. This is it, only $1,000. Now let's compare it to how much does it cost you every hour or every day that this machine is not working. Another thing that we've noticed is the emerge of triple extortion attacks. In those types of attacks, the attackers are working in 3 steps. The first step is to steal the medical records. In the second step, they will encrypt your data inside your environment and will also lock down your systems. And now they will ask for a ransom for the decryption key, and will also try and blackmail you in order not to publish the data over the internet, over the web. But there is also a third step now that we are seeing. In this third step, they will also, they're going to approach the patients themselves and will also try and blackmail the patients for not publishing their personal data and medical records over the internet. And this is exactly what happened a few months ago in Finland. This healthcare organization were attacked by the ransomware group. They have managed to get access to the medical records of 40,000 patients and demand a ransom of $500,000. They've also approached the patients themselves with a demand for 40 Bitcoins. During that time, it was still only $200, and they demand this ransom in order to prevent the publication of their discussions with the therapist over the internet. So one of the biggest security gaps when looking on the healthcare network is the medical devices. Those devices that are widely deployed can be easily accessed, and it can be directly or from the internet. Also, those devices are highly vulnerable and very easy to hack into. Most of the devices don't even have basic security capabilities, and many are based on outdated software and legacy operating systems. By the way, the average lifespan of a medical device in the hospital network is around 10 years. And we have operational limitations that preventing us from going and patching those devices, from going and updating and upgrading those devices. And those limitations can be, for an example, devices that need to work 24/7, or maybe it can be different medical certifications that preventing us from going and doing changes inside the software of those devices. And in many cases, we just don't have the visibility and management tools in order to go and to patch those devices. So you will find many devices inside the hospital network that are based on old operating systems and unpatched operating systems. It can be Windows 7 with no security patches. Many devices are based on Windows 1000, and it can be even devices that still runs Windows XP. Now, the attackers, knowing that, using those devices in 2 ways. The first way is hacking into the devices themselves and then manipulating those devices. And by doing so, damaging the operation of the hospital and maybe even harm a patient. For an example, it can be an infusion pump, and the attackers can change the dose that this infusion pump is injecting to a patient. The second way is using those devices as an entry point into the hospital network. Because in many cases, those devices are also connected to the external internet. It can be because we would like to enable the different vendors of the different devices to be able to access them for monitoring, management, analytics, or maybe we would like to enable remote access to our medical team to those devices and so on. So the attackers can scan the internet for those devices, find them quite easily, connect to them quite easily, and hack to them quite easily, and through those devices to get into the hospital network. So we need a solution that will protect the devices themselves, will prevent unauthorized access and malicious intent from reaching the devices, and that will also prevent infected devices from compromising other devices and network elements. And this is exactly what we are offering you with Checkpoint IoT Protect solution. It is based on 3 pillars that we can refer also as 3 steps. The first step is discovery and risk analysis. We need to start by finding all the devices inside the network, classify those devices, map the connections between the devices, and also analyze the risks that those devices pose inside the network. The second step is to take this information and turn it into a suitable policy. We need to define who can access those devices and who we should block, what traffic is legal and what traffic is not legal. And of course, we need also to enforce this policy inside the hospital network. And the third pillar is to identify and block malicious traffic. And we should do that at the perimeter before it is entering the network itself, but also inside the network, identify and blocking lateral movement. So the first step is to discover and analyze the risk of all of those devices. And in order to do that, we've developed a unique API that enables us to collect any type of information from any discovery service. And definitely, Medigate is one of the leading discovery partners who we are working with today. So I'm going to pass the stage now to Tom, who's going to overview Medigate and their solution and the integration together with Checkpoint. Tom, the stage is yours.
Okay. Well, thank you, Itzik. I guess it goes without saying, security visibility yields security control. You know, it's all about the data and what you can do with it. If we go back, for example, just a couple of years ago, you were seeing the market leaders in IoT cybersecurity talk about device discovery and identification and competing in evaluations on the basis of who is able to discover and catalog the most stuff. Those aren't even table stakes anymore, and that's important. For Medigate, because we entered the market having already invested in writing the parsers for all of the unique proprietary medical device communication protocols, we quickly proved that IoMT devices, medical devices, could be passively discovered and fully profiled at a level of granularity that frankly surpassed even some general IoT. So let me put it this way. In 2021, you should expect all connected assets to be fully profiled, meaning any all specific attributes of the device, not just make, model, and IP address, but firmware levels, operating system versions, applications running on the device, serial numbers, location, the network status of the device, all of the details underpinning its security posture, and now, which is very interesting, all kinds of metrics surrounding how the device is being utilized. To get there, it means that we're pulling data elements, both static and dynamic, that we cannot parse from the traffic flows, and getting them from network management systems and other networked applications we're integrated with, you know, from CMMS to EDR. Put simply, when you've got your hands on 80 to 90% of the data you would ideally want, it's not as difficult to find the remaining pieces of the puzzle. In fact, you learn how and where to look for them. Even better, when you have this much information on a per asset basis, you can accurately and continuously enrich each asset's profile based on matching back to research conducted offline. To be clear about this, security visibility for Medigate includes a knowledge base of each asset's operating requirements, including authorized internal and external connection types, which allows us to act as a monitor. So why is this important? Well, it's about automation. You can not only eliminate outdated routines, but you can deliver game-changing automation that frees up staff for more meaningful work and drive even further leverage via what frankly is a natural convergence that we're seeing taking place between traditional separate workflows spanning HIT and HTM. When you know the right details of the device, then correlating existing vulnerabilities or newly published threats to potentially affected assets is automatic and is generating appropriate, generating appropriate remediation instructions. That's a huge advance. When you know what the device is, where it is located, how it is being used, and when it is being used, for example, you can write rules that say when this infusion pump has stopped infusing and its status has remained idle for 3 hours, send an alert to our distribution and nursing staff handling that area of the hospital to move the device into its restaging area. And for the same reasons that we can automate remediation instructions, we can generate appropriate security policy for NAC and rules for firewalls too, which is of course the basis of our integration with Checkpoint. Here's a view of what we see as a converged ecosystem where Medigate is bidirectionally integrated and synced with most everything. From making sure IT and clinical engineering and biomed professionals are singing from the same sheet of music, meaning all held inventories spanning CMDB-based ITAM and ITSM solutions and CMMS share the same common foundation, to pulling and pushing data from and to agent-based EDR, to providing VM administrators with a way to finally conduct identity-based scanning, to closing, importantly, the loop on security enforcement mechanisms. It's not just possible, it's not a pipe dream. All of the things I'm talking about here have been operationalized. So Bob, the significance of the NotPetya attack to Heritage Valley, well, let's just say it's multifaceted because it not only served as a catalyst for your organization to invest and upgrade your ecosystem, but you know from experience that the integrations I've just discussed here are not only possible, but rapidly and naturally achievable. As a Checkpoint client, you know firsthand about the integration value. So I'm going to stop right here and encourage you to share your journey with the audience.
Sure. Thanks, Tom. So everybody looking at this slide here of the Checkpoint and Medigate converged operations, I'm sure that you can all put yourself in this position and see each one of these islands in your current environment. And you think to yourself, yes, I have IT, security, and biomed, and some level of collaboration between them. But they all have these, as shown, disparate solutions and disparate sources of data. And, it's very common that they are indeed islands or silos as pictured. But all of those arrows in between, as Tom described, that is not just a pipe dream. That is actually possible. And we are experiencing it in production today. And that's why I'm going to share with you some of my story here. In terms of Heritage Valley Health System, we're a mid-sized healthcare organization in southwestern Pennsylvania. We have 3 hospitals. We have approximately 70 other satellite facilities, and we have thousands of medical devices and IoT devices spread throughout that environment. So that's an awful lot to try and get your arms around. So let's talk first about visibility, and let me give you a little, history in terms of how this all started for us. As Tom mentioned, we were the victim of one of the most significant supply chain attacks at that time in 2017, the NotPetya global supply chain attack. And I know that a lot of organizations over the past year have also been impacted by SolarWinds and most recently Kaseya. Supply chain is unfortunately a very popular, a very effective means of attack of organizations. And just like everything else that we work with in terms of technology and cybersecurity, it's going to require a focused collaborative effort for us to start to improve our security posture together. But we were again a victim, and the NotPetya attack was not a ransomware attack. It was designed to be destructive. So a lot of people believe that it was ransomware. It was disguised as ransomware, but it was actually a destructive attack. And at that time, in our world, we had Biomed with a very mature CMMS. It was very well managed. It was an accurate picture of the inventory of devices across the organization, and their status for preventive maintenance and so forth. But what was lacking was any information related to whether or not the device is connected to anything else, any attributes associated with that connectivity. That was a significant gap. And it wasn't the fault of the Biomed team. It was just not, something that was inherently built into their solution and not a daily item that they were focused on. Now, on the IT side, they had, IT inventories, asset management, and, they had IP addresses associated with maybe a device description, but they didn't know specifically the make, model, serial number of those devices. So from a visibility perspective across the organization, we had these traditional silos of very little visibility and information shared from an IT and network perspective, and the Biomed CMMS. We did have, traditional segmentation of devices through the firewall, so we had some visibility there on those devices. Also, devices that were connected to the clinical wireless network, which is a separate wireless SSID for IV pumps and other mobile devices. But again, pretty much everybody saw their part of the pie, but didn't see everything else. So during the attack, we did have, unfortunately, medical devices that were impacted. And I first want to state that there was no impact to patient care. We maintained patient care. The hospitals stayed open, providing care to all the patients, which was our primary priority. First and foremost was to ensure that we can continue to care for everybody that was currently in the hospitals. And so the devices that were affected was a pretty wide range, and they had both embedded operating systems and maybe adjoining operating systems, other kind of control stations that worked with them. Some of them had legacy operating systems. Some of them had current operating systems. Mobile X-ray was impacted, DEXA, MRI, other devices as well. And our first concern, again, was maintaining patient care operations and our ability to take care of them. The availability of the devices, the status of the devices, the recovery of those impacted devices. So that remediation required a lot of collaboration between Biomed IT, OEM manufacturer representatives and service representatives. Everybody teamed up to address this. And the good news is we did recover very well, again, maintained operations, but lots of lessons learned, as you would imagine, from this level of an attack. So action items from post-attack assessment. We had a lot of assessments done, and one of the items that was brought to our attention was the need to identify a comprehensive medical device risk management program. So while we had, again, these pockets of information, we really didn't have an overarching program to manage the risk for those devices across the ecosystem. And, honestly, I'm sure many people have heard this before. You can't manage what you can't measure. It's all about accurate real-time visibility of your asset inventory. And that's where we started our journey. So we initially started to try to use the data from the CMMS and the IT asset inventories in our traditional vulnerability management solutions, the scan data. And We spent a couple months trying to cobble those together, and it was not very successful at all. There were too many disparities in the data sets. There were no common index values between those data sets. And at that point, we realized that we were going to need some assistance to try to get our arms around this challenge. And we assessed a number of solutions at that time. This was back in 2018, going into early 2019. And we did a few proof of concept evaluations. And we had some solutions that identified a large number of devices, but the accuracy of that identification in terms of those attributes, operating system, firmware, manufacturer, et cetera, were lacking. And when we decided to engage Medigate in a partnership, what we found was that the Medigate solution really exceeded our expectations in terms of this first step of the process to eliminate the physical inventory, build that dynamic digital inventory, and again, give us all of the attribution of those devices, not just what they are, but how they are functioning. As Tom mentioned, utilization management, how are they functioning? What are they communicating to across the network? And it started to build that foundation, if you will, that we could then step into an integration phase and begin to enrich that data. So the enrichment of that data was, again, key to beginning to do some basic controls. You have to get a better understanding of not just what the devices are, but what they're doing. And the accurate real-time inventory was key to that. So we have integrated right now with a number of our solutions across the security stack. We have integration with network access control and firewalls, as well as endpoint detection and response, vulnerability management, and Active Directory within our environment. And all of those integrations give you now actionable data that you can use to begin to remediate a number of different types of scenarios. So as pictured here, one of the most significant pieces of information that we gained from this platform is a dynamic risk score associated with each individual asset. And again, I've said this before, this is a risk management program for us. It's not so much just security for the sake of security, but we're trying to assess the risk and then prioritize our actions based upon those highest risk areas. So the Medigate platform with its data set gives us a risk score along with insights into the vulnerabilities and threats, both with native to the Medigate platform as well as what we get from our vulnerability management system. All of that is correlated together, and then we can assess and prioritize what the potential threats would be to those devices. A key function is not just understanding the risk, but when you go to remediate it, what is the impact going to be? Are you going to hit the mark? And what we found was that the risk remediation simulation capability within the Medigate platform allows us to do that type of what-if planning before we make any changes at all at any layer. And that really gives us a better projection in terms of what our effectiveness is going to be, because we don't want to have to touch these devices multiple times. We want to try to assess the risk, address the risk, and move on to the next priority. So the real value of Medigate having access to all this information, as Tom said, is not just the fact that it's there and you can use it, but that it helps to build what your remediation instructions are going to be. What do you need to communicate to the firewall? What do you need to communicate to network access control? And all of that, obviously, with an audit trail that gives us and others that are assessing us on an ongoing basis confidence in the process that we use to manage risk and the controls that we are implementing. When you look at the checkpoint and Medigate integration slide here, it really, you could do all this manually. And anybody that's been in the business, going back to, again, legacy types of segmentation efforts, because you can't put segmentation agents on devices. The OEMs have them locked down. They will tell you that it'll be unsupported and all of these other restrictions. But what you gain with this direct integration is a greater value of your time and effort, because you're not constructing all of this manually, these object lists and these object definitions and what the ports and services are. The Medigate platform packages all that and makes that available to the Checkpoint platform, that then you can very easily build your rule sets within the policies across the organization. And again, that can be, between devices, on the same network, across networks, between locations. As you see in this diagram, you really have the ability to control all the way across your ecosystem. This is a screenshot actually of the Checkpoint gateway and some examples of the rules. And once these objects are defined, it really is that simple to take this real-time information and have these policies generated. For example, you only want the MRI to be able to communicate to the PACS storage. So the objects are created for you, the ports and protocols are identified for you, and building the rule now is not a laborious effort. It's just a matter of implementing it, pushing policy, and then assessing your activity to ensure that there's no other activity, no other communications that you need to address. So you can do this for individual devices, you can do this for groups of devices, however you want to build your policies. But the fact that you don't have to do it manually is a huge time saver. And I got to tell you, I don't have a large team. I don't. And most organizations don't either. The ones that do, God bless you, I'm glad. But even for those organizations that have a larger team, this benefit of having the policy information pre-populated, and then you can just tune it to your needs and implement, is not just a huge time saver, but it also makes it much more accurate, makes it much more timely in terms of actionable addressing these risks. Another example listed below, if you want to have communications, again, as Itzik mentioned, you have devices that are communicating outside the organization for various support processes and updates and monitoring, to identify groups of devices and restrict that communication to that specific vendor domain or set of domains or set of IPs. It's just that easy to implement that policy once you have the power of Medigate collecting that data and sharing it with the Checkpoint platform. So going into the healthcare cybersecurity solution, I think you've heard me touch pretty much upon each of these goals. Protecting patients safety, ultimately a primary goal of ours. We want to ensure that these devices are not compromised. We want to ensure that patients not affected by a device that could potentially be providing them with some type of treatment or service. The medical data, again, highly valuable, worth much more on the open market than a credit card record or what have you. And then the healthcare operations, maintaining that availability and accessibility to all of your devices. And again, everything I've mentioned here applies certainly to medical devices, but the same level of functionality across IoT devices as well. So just imagine that. I mean, we went into this project initially in 2019, focused on medical device risk management. but it is so much more because now it has evolved into all connected device risk management and utilization management. So, Itzik, do you want to talk a little bit more about how this comes together with the Checkpoint platforms?
Yes, of course. So I think the important thing to emphasize here, and we need to remember that when looking on the hospital network, it's not only about medical devices. It's not only about the IoT devices. I'm sure you understand, Robert, what I'm talking about. You need to protect the network, the data centers, the doctors who are using mobile devices for treatment, and so on. So we have a Checkpoint, our Infinity architecture, and this architecture is basically an architecture that covers all the elements that you need to provide a consolidated, comprehensive security for everything that you have inside your hospital. Now, inside, we divided it into types of, let's call it groups. We have, or pillars. We have the Quantum. This is a group of products for securing the network. We have the Cloud Guard. Many of the hospitals are in a process of migrating to cloud services. It is important to provide security there, both for the infrastructure, both for the SaaS applications that you might be using, and maybe even native cloud security in case you have your own development. And of course, we have the Harmony for securing users and access. Remote access is a big thing. Lots of the medical teams now working remotely, and I think one of the things with the COVID-19 that it pushed lots of us to start working more remotely, and everything is being covered by our Infinity Vision, a unified solution that is being managed through one single platform. I think this is very important to remember that when looking on the hospital network. Okay, so we go to the questions part.
We've got some questions, Itzik, and I'll go ahead and kick it off. There's a question here for you, Bob, in terms of the effort associated with operationalizing the various integrations of Medigate data on a relative basis. How difficult was the integration with Checkpoint?
Robert, you're on mute.
You're on mute, Bob.
Oh, I don't believe it. Okay, so thank you. I apologize for that. I know there's going to be some skeptics listening because we've all been through integration projects and we all have the scars and the stories. But I tell you, I was pleasantly surprised at the integration ease. The Medigate team has really worked hard to make this as simple as possible, not just within the tool itself, but also within the documentation and the services that they provide. So some of these integrations were, I know it's going to sound unbelievable, but some of them really were plug and play. The integration to vulnerability management was less than an hour. The integration to endpoint detection and response was simply an API key, and then it started talking. So I think in a world where, again, we're used to integration projects that sometimes drag on and never get finished and never work the way you expect them to. That was not our experience here, certainly with Medigate, and in terms of Checkpoint as well. Their development of the IoT, IOMT blade within the gateways really, this collaborative relationship shows the benefit and the value of this. Shows these teams have really worked well together to make this as simple as possible. So I know it sounds unbelievable, but it's true.
Is there anything you'd like to add, Itzik?
After that, I think I just can emphasize everything that Bob said. Yes, it's amazing. This integration have lots of value. At the end of the day, it's about value. We want to provide you value, a security value. And all of us are at least Checkpoint is a public company, you're a little smaller company, and of course that we want to sell. But the important thing is to provide security value to the customer, and I think this is exactly what Bob said here. There is a security value. It's very intuitive, very easy to deploy, very easy to use that. It is very important.
Yeah, I would only add that, especially if I'm sitting in the audience shoes and I'm scratching my head about this, you know, most vendors in the marketplace will talk about being integrated across the ecosystem, and they'll talk about their API. I would simply caution you to keep in mind that there's a big difference between the data exchange that occurs at the API level versus an interface versus a meaningful value engineered integration, which is what Medigate and Checkpoint have developed here. In terms of the engineering that goes into this integration, as well as others, to Bob's point, you know, he was afraid to say something that I think was on the tip of his tongue, which is some of these integrations are self-serve. They're literally executed on a self-serve basis in the application. So when I said earlier, these integrations are operationalized, there's a great deal of experience and success behind them. That's the evidence. So let's go to another question here. Is your Itzik, is Checkpoint's integration with Medigate solely intended to enhance coverage of medical assets, or does it extend to all connected assets?
Okay, so yes, we need to deal with all types of IoT devices inside the network, sorry, assets. And definitely we support in all of those. It's not only about medical devices. We need to take into consideration that a hospital, I'm always saying, it's like a small city. You have gas systems and water systems and electricity systems, and you have labs, and you have general IoT devices, you have office devices, you have printers, IP phones, IPTVs, everything is there. Those devices are also highly vulnerable and very easy to hack into. I have some crazy stories about hospitals that I've met with attackers that managed to hack into a thermostat in their lab and to shut down the operation of the hospital. With one of the hospitals, by the way, they have a pneumatic system for sending a medicine and blood samples inside the hospital, and we wanted to show them how easy it is to hack into this system. And remember asking the CISO, what will happen if we shut down this system? He told me it's like going back 50 years in time. So this is why it's very important to protect all types of assets inside the hospital network. The combination, the integration between Medigate and Checkpoint supporting that. Inside Medigate system, there is a support to discover all types of assets. If you will go into the dashboard, you will be able to see all of those cameras and printers and SCADA systems, everything. You will see everything there. And all of this information is being sent to Checkpoint management system. And inside our management system, we have a dedicated application control for the unique applications that those devices using. So it can be, for example, if it's IP cameras, it can be the ONVIF protocol, or if it's industrial devices, you need to support the Modbus and the SCADA protocol. Everything is supported inside.
A follow-on question here is, can you measure if you have blocked a real cyber attack after it's been implanted or occurred in the system?
Yes. Okay. So when saying cyber attack, it's something that is very, very wide. But inside our system, it's inside Checkpoint security gateways, we have threat prevention engines. Those threat prevention engines, basically what they are doing, they monitoring the traffic and can identify the attack pattern. If we will take, for an example, attack pattern that tries to use non-CVE. There is a non-CVE, there is a non-vulnerability for one of the devices, and inside our system, you can activate the protection inside the IPS. So yes, we will identify this attack pattern, we will block it, and of course, we will notify you. You will get an alert for it. But there is another thing we need to consider. There might be a case of infected device inside your system. And we need to accept that because we're talking about, as Bob said, thousands of devices. We also monitoring the traffic that goes back from the devices to the internet. And we're looking on the other side through our, we call it infinity SOC solution. We're looking on the other side and we can tell you, listen, this URL on the other side, it's a bad URL. It is related, for example, to a Mirai attack, to the, we know it's a domain that related to Mirai attack or one of the Mirai variants. So based on that, we can tell you this is an infected device. We can raise the risk of this device to, okay, this is an attacked device. It's not even critical risk. It's immediately you need to block this device, and we can put a rule that will automatically block this device for communicating with the internet. Again, we need to remember that this is a hospital. We need to consider that it might be a critical device for the hospital operation. We don't want by mistake to block an important medical device, but everything is configurable and supported inside our system.
We've got questions rolling in here. I hope we can get to most of them. So for both of you, do all the devices authenticate in AD? Is there a radius server integration?
Well, in our environment, I can tell you that not every device is AD authenticated. So we do try to integrate as many as we can, but there are some that are not AD integrated. And yes, we do have a radius server in that authentication loop.
Itzik, any additional comment? I've got plenty here.
Yeah, I'm trying to read all the questions at the same time. So no comments. We can move to the next one.
I was thinking, Bob, does Heritage Valley have firewall rules for medical devices that block all traffic and only allow necessary traffic, or does it just monitor, detect the traffic?
Oh, no, we have many different rules that are blocking traffic from not just known bad sources, but anything that, again, we have not determined to be necessary to the ongoing operation of devices. So we restrict on many rules, ports and protocols and services, and we do have some things that are monitored, detect, but most of our traffic gets blocked and dropped.
I just want to add something regarding that. Working with the hospitals, what we are seeing is there is a process. You will not start immediately putting enforcing rules inside the network. There is a process. Usually what we are doing, we starting by discovering the devices, and then we calling it logs rules. So the only thing we want to see is the traffic itself. Where does it go? Usually we will start with a very simple rule. Show me all the medical devices that communicating with the external internet. Start with that. Believe me, we'll find lots of communication there, but then we can go inside and start turning it into a whitelist. This is okay, I'm accepting this rule, and everything else, now we can block or keep alerting regarding it.
Right. Yeah, I think that's, that workflow is common in any segmentation project. You first gather your data, you assess your data, you understand what your communication source destination are and the business purpose, and then you go into a mode before you apply your controls. I was talking, at the endpoint there, yes, controls are applied, but yeah, it's a workflow.
Mm-hmm.
So let's see here. Do you, for both of you, do you see, well, actually, I guess it's for all three of us. Do you see utilization data being used in an enforcement and a security enforcement context?
Yes, absolutely. Understanding the status of that device at any given moment and the ability to take action upon anything that is alerted is critical. We can't operate in a vacuum. So the Medigate platform does provide that real-time utilization. We can see if a device is actively being used, where it is, where it's communicating, and then correlate that to who might be providing that service in terms of the user, and then ultimately Is there, who the patient is, but no, there is a correlation of that utilization before any actions are taken.
Mhm.
Itzik, anything you'd like to add?
I think we need also to remember that utilization is a great tool to look for anomalies. And I think it is very important. You see in a device that suddenly started to work during the weekend. Never worked. It's sleeping during the weekends for 1 year, and suddenly it started to work during the weekend. Or a traffic burst that goes out from one of the devices, and so on. So we need to identify those anomalies. By the way, it doesn't say there is a real attack here, but it's meaning that something is happening, and we need to go and look into it.
Bob, this one's for you. As it's understood that you're a Checkpoint Gateway client, do you see other data from other systems like Medigate or beyond Medigate extending the benefits of your current security ecosystem?
Absolutely. This is now not just a single solution for us. This is now part of our entire security stack that is layered across the entire environment. So, there's plenty of value and benefit, again, with each and every integrated application. So, from a control perspective, obviously, working with Checkpoint to establish those controls at the firewall level is very effective. Also, network access control, but we're beginning to integrate the utilization data with other operational reporting metrics to really drive other changes within the organization, both from a security perspective in terms of trying to proactively improve our posture, but then also operationally.
How easy or challenging was it working with your medical stakeholders when looking to lock down the traffic for IoT?
It's historically, each team again is an expert in their own area, and there's mutual respect, but limited understanding of that perspective. But I think what helped is everybody looking at the same view of the information across biomed and across IT and information security. I think that really helped to mature that collaboration, because we were no longer just looking in our own individual view of the world. We were all looking at the same view and building that understanding together of how this device was functioning, how this device was communicating. It really became a great collaboration platform for us that historically, there were some gaps and there were some challenges, but I think the platform itself even helped to build some of those relationships.
I'll tell you what, there's a question here that I'm going to go ahead and say right out of the gate. Whoever's asking it, please reach out to us and we'll give you a better answer than the one that I'm about to provide. And I'll look for help from you, Bob, as well as Itzik. But it says, when you mention comprehensive and detailed asset visibility and comprehensive intelligence, before we apply access controls, we need to know, for example, is an infusion pump delivering chemo or saline? Plus, on what date was the pump last serviced? What is the name of the person who owns that device? How do you integrate this context? The reason why I'm willing to accept that question is there are answers to it, and it goes to establishing a detailed single source of truth, as we have indicated, perhaps making that single source of truth available in the CMMS, which then can orchestrate that information to the right systems downstream. We work with a client right now that has developed a rules engine that, for example, recognizes average infuse times on everything other than chemo, for example, which tends to be significantly longer. So they have written rules which define the alerts that accelerate maintenance interventions, which of course are logged and can be referenced. and or move devices into restaging. I think the thoughtful answer that you deserve to that question is something that I'm willing to even sit down and write out for you. But it's a very interesting area of benefit right now, derived from the utilization metrics in conjunction with the context provided via all of the other asset data that are being collected. Bob or Itzik, do you have any comment you might want to add there?
I would just say that because it's not just an interface of information, but an integration of information with the CMMS and Medigate, you have the ability to you can work in either platform in order to understand the scope of utilization of your asset. So you're going to see value in the CMMS of, like you said, when was that device last serviced, and then you're going to see current utilization in Medigate. So as Tom said, the answer is yes, but it really requires a little bit more description to that to kind of detail it out.
Mm-hmm. Well, I'll tell you what, we're coming up on the time. Itzik and Bob, I don't think we really have time for any more questions. So Itzik, I'll punt back to you to wrap up, and thank you for me. Thank you very much to the audience, and again, good working with you, Bob. And Itzik, back to you.
Okay, so it was a great session. I'm really happy about all of those questions, guys. Anyone here in the audience, let me present here something. 1 minute, please. Okay, in case you would like to get more information, you have here the contacts of John Michel Gilher from Medigate and Divenes Moses from Checkpoint. They will be happy to help you if you have any questions. So you have the contacts here. Please do not hesitate. I would like also to thank you all for coming and listening to us. It was a pleasure hosting you. Bob, Tom, it was a pleasure. Thank you for joining us. Thank you for working with us. It is a great pleasure. And hopefully, really hopefully, that I will manage to meet you face to face very soon.
Thank you.
Okay. Bye-bye.
Bye-bye.